The WHO's leading vaccine expert admitted in court that vaccine passports were a scam because the vaccines were never intended to stop transmission. And with vaccine companies around the world still recording record profits and avoiding taxation, we ask you, is the legacy of the pandemic era only just beginning? And what more will be revealed? Hello there, you Awakening Wonders. Thanks for joining us on this voyage to truth and freedom. We need you to become a member of our movement by clicking the link in the description. You'll get access to additional content that we cannot share on platforms such as this because it's too conflagratory. You know us, we'll take it right to the very limit. We'll find ways to weave webs of truth before your very eyes that we may be unveiled, that the scales may fall, that we may awaken together, live in harmony forever. But to do that, we're going to have to understand what's been going on for the last few years. In particular, the ever-evolving and devolving story of the pandemic period. Now we know, as the WHO still lobby for a global treaty that will give them unique powers to impose legislation and regulation and control, that their own vaccine expert admitted that vaccine passports were always a scam. So just bear in mind for a moment those people that said, hold on a minute, is this like a form of social credit score? Is this just like a social control measure? And they went, no, this is a measure to protect people. We know that in places such as Canada, vaccine passports drove compliance and effectively served as a mandate by driving up vaccine rates by as much as 17.5%. So what exactly has been going on? And why is it left to countries like Finland to fly the flag for freedom, while nations like the United States and the United Kingdom are oddly compliant to globalist corporatist entities? What exactly is going on there?
Now, on Friday, the 12th of April, Asim gave a deposition, I suppose you would call it, to Helsinki District Court just last Friday, where he was essentially an expert witness. Now, it's interesting and disappointing that aspects of reality are drifting in from places like Finland. We looked at data over the past few days from Japan. Pity more data isn't coming from, the United States, Canada, the United Kingdom, Western Europe, Australia, New Zealand. Information is coming in from diverse other countries.
Now, in Japan, there are protests against the WHO treaty, and in Finland, there is, as Dr. John Campbell there alluded to, a civil case to investigate certain measures that were undertaken. So let's dive in detail into this story and see how we're still being affected by regulations and lies perpetuated in the pandemic period. The World Health Organization's Dr. Hannah Neuneck testified in court that she advised her government that vaccine passports were not needed, but was ignored, despite explaining that the COVID vaccines did not stop virus transmission and the passports gave a false sense of security. The stunning revelations came to light in a Helsinki courtroom where Finnish citizen Mika Valkala is suing after he was denied entry to a cafe for not having a vaccine passport. That guy really needed his coffee. You deny me my coffee, I take you to court. Dr. Neuneck is chief physician at the Finnish Institute for Health and Welfare and serves as the WHO's chair of strategic group of experts on immunization. Stay away from parking lots, Dr. Hannah, is what I would say. Testifying yesterday, she stated that the Finnish Institute for Health knew by the summer of 2021 that the COVID-19 vaccines did not stop virus transmission. During that same 2021 time period, the WHO said it was working to create an international trusted framework for safe travel while EU member states began rolling out COVID passports. The EU Digital COVID Certificate Regulation passed in July 2021, and more than 2.3 billion certificates were later issued. Visitors to France were banned if they did not have valid vaccine passports, which citizens had to carry to buy food at stores or to use public transport, all of which, it now seems, was a colossal waste of time and money and propaganda. So why do it? Who benefited? Is this just some kind of innocent error, an innocent mistake perpetuated at scale to the tune of 2.3 billion peculiar pieces of documentation issued? And think for a moment of all the personal inconveniences that were accrued by you. Either you took the vaccine and potentially there were consequences to that under the belief that you were helping or protecting other people, or you didn't take the vaccine and were therefore restricted access to various facilities or shamed or emotionally damaged in a variety of ways. Why did this happen? And why are we being invited to put it behind us with such extraordinary haste? But Dr. Neuneck testified yesterday that her institute advised the Finnish government in late 2021 that COVID passports no longer made sense, yet certificates continued to be required. Finnish journalist Ike Novikov reported the news yesterday after leaving the Helsinki courtroom where Dr. Neuneck spoke. Wait, so a WHO advisor, a senior advisor, a medical expert was completely ignored. What did they mean then when they said they were following the science? What does Dr. Fauci mean when he says, I am science? What does it mean when we are told that these are scientific interventions, not regulatory measures undertaken in an ad hoc manner, when we now know that the 6 feet social distancing measure just sort of emerged, that vaccines didn't prevent transmission and they continued to recommend and issue passports even when they knew that? What is beginning to become clear? Let me know in the chat. Tell me what's emerging from the fog of this deceptive period. Dr. Neuneck's admission that the government ignored scientific advice to terminate vaccine passports proved shocking, as she is widely embraced in global medical circles. Besides chairing the WHO's Strategic Advisory Group on Immunizations, Dr. Neuneck is one of Finland's top vaccine advisors and serves on boards of Vaccines Together and the International Vaccine Institute. So she's hardly an anti-vaxxer, is she? So if the chief vaccine strategist of the WHO is being ignored, where does the power that the WHO implements come from? Where does the science upon which they're acting come from? How is it formulated? Via what trials? Via what information? And does it become increasingly relevant that the WHO is funded in a peculiar and unique way? And you can let me know in the chat right now who is a significant funder. And if it's not based on empiricism, as was claimed, what is it based on? Interrogate this yourself. Follow the science. The EU's digital COVID-19 certification helped establish the WHO Global Digital Health Certification Network in July 2023. By using European best practices, we contribute to digital health standards and interoperability globally to the benefit of those most in need, stated one EU official. Finnish citizen Mika Valkala created a website discussing his case against Finland's government, where he writes that he launched his lawsuit to defend basic rights after he was denied breakfast in December 2021 at a Helsinki cafe because he did not have a COVID passport even though he was healthy. The Constitution of Finland guarantees that any citizen should not be discriminated against based on health conditions, among other things, Valkala states on his website. We can't continue to bring you this beautiful content without the support of our partners. The Wellness Company are some of my favourite partners. Will your doctor even prescribe you ivermectin or hydroxychloroquine? Hey, I did it. The Wellness Company's prescription contagion emergency kit is unique, providing carefully selected effective medications for COVID-19 and respiratory illnesses. Ivermectin, hydroxychloroquine, which some people call HCQ, don't know why, Z-Pak, and butanide, along with a nebulizer and guidebook for safe use. Do not muck around with a nebulizer. This is, of course, backed by research and endorsed by experts, specifically Dr. Peter McCulloch and Dr. Harvey Rich, both friends of the show. Avoid the chaos, wait times, and price of the hospital. Get the entire kit for the cost of a single doctor's visit. This is only available in the USA. Every American home should have one of these, don't you think? Visit twc.health/brand and use our code BRAND to save $30 plus get free shipping on your contagion kit. Okay, back to the content. Valkala's lawsuit continued today in Helsinki District Court, where British cardiologist Dr. Asim Malhotra, shout out Dr. Asim, remember to watch our episode, up now, fantastic conversation, will testify that during the COVID pandemic, some authorities and medical professionals supported unethical, coercive and misinformed policies such as vaccine mandates and vaccine passports, which undermined informed patient consent and evidence-based medical practice, the opposite of science and the opposite of freedom. So what on earth is going on? So if vaccine passports weren't for safety and protection, what other motivation could there be? Remember, there was a moment where access to, for example, nightclubs and concerts was restricted on the basis of proof of vaccination, and many people thought that was because young people were not getting vaccinated in significant enough numbers. Let's have a look. COVID-19 proof of vaccination requirements, commonly known as vaccine passports, led to more Canadians under 50 getting their first dose shortly after the policies were implemented, according to a 2023 study by public health researchers. Nationally, researchers estimate first dose vaccination rates jumped 17.5% in the 7 weeks after provinces announced proof of vaccination policies, the study says. So now we have scientific data, but you also have your memory. Why did you take a vaccine if you took a vaccine? Was it because you felt like, oh no, I'm really worried that I might catch COVID or that I might give COVID to a frail or vulnerable relative? And if it were the second of those two reasons, that was stupid. Not that you're stupid, that's what we were kind of led to believe. Or was it because you simply wanted to go out and live life to the full, or travel, or go to work, or the many other motivations that were, it seems now, increasingly not valid and yet heavily pushed. What does this tell you? What should we remember before granting the WHO the ability to impose regulations just like they did before? Again, additionally to that, of course, it was an incredibly profitable period for some of the most powerful corporatist entities on Earth. While jacking up drug prices, Pfizer recently reported more than $27 billion in revenue from its US sales in 2023, but the big pharma titan owes nothing in federal income taxes despite being one of the most profitable pharmaceutical companies in the world. How can that be the case? How can you be so profitable and not owe any taxes? You make money, right? You pay taxes, right? You know where your taxes go. You know that they're part of a peculiar circuit of investment that frequently doesn't include you. So what's so special about Pfizer? How did Pfizer get themselves in this extraordinary position? Some of you had to take a vaccine in order to go to work to pay your taxes that Pfizer don't. What is this circle I'm drawing? It's a circle that we're being penetrated in. Pfizer's tax dodge illustrates how those corporations, in particular pharmaceutical and tech giants, are able to enjoy astonishingly low tax rates by using a system of lucrative tax loopholes. While legislation to halt such tax schemes has stalled in Congress, corporate giants often stash intellectual property rights for their drugs and other products in offshore tax havens and force their US-based operations to buy the rights to manufacture and sell those drugs and products here in the United States. It seems they live in a different world than the rest of us. While we may occupy the same geographical space, we clearly don't occupy the same ideological or economic space. One thing is for certain, we shouldn't be granting further authority to these unelected, potentially corrupt institutions and organizations that don't even listen to their own advice if their own advice goes against what appears increasingly to be an agenda. I'm referring, of course, to the case in Helsinki where their own vaccine experts said, well, there's no point in vaccine passports. It's going to make people have a false sense of security if your agenda is protecting people because, of course, the vaccines don't prevent against transmission. Shouldn't we let everybody know that? We're just going to take a little phone call from a few people. No, we're not going to be telling anyone that for a little while yet. Observers say that the latest draft of the WHO treaty amendment seemed to have toned things down a little, but continues to provide for WHO's expanded powers along the said lines. So, look, the good news is it has an impact when we make a lot of noise, when we oppose, when we unite, when we say, hey, this WHO treaty looks like you might use it to impose lockdowns and certain medical measures on the basis of everything from climate change to a cough. We're against it. They've gone back and amended it, but have they amended it enough? Initially, the amendments were worded such to allow the WHO to strengthen its own abilities when it comes to combating misinformation and disinformation. That means information that they don't like. True information that might arm you with the facts and make you a little more recalcitrant and a little more empowered. Whereas now the text says that the WHO will coordinate and support locally on matters like risk communications, including misinformation, etc. So they still have the power, they've just diluted the language a little bit. What you'd probably want the treaty to say is the WHO's closed now because they really ballsed up that last pandemic, ignoring their own advice, potentially exacerbating certain conditions, ignoring the economic impact on some of the world's most vulnerable people, collapsing our economies generally speaking, creating a mass outbreak of psychosis, not correctly measuring the impact of some of the products they heavily endorse on other medical conditions, not to mention the impact of lockdown measures on medical conditions such as heart disease and cancer. They've clearly not made Pfizer and Moderna accountable for some of the impact of even their clinical trials, let alone the adverse injuries potentially caused by their products. Here's your treaty. Do you want to sign that? Well, let's ask Klaus. He's in a comparable organisation. Bill, Klaus, I think we were in trouble. The other important point is vaccine passports and which entity has the ultimate say in issuing and requiring them. On this, the WHO still wants the ability to require these as well as recommend to nation states to carry out a number of proof reviewing exercises. These concern not only vaccine passports, proof of vaccination or other prophylaxes, but also proof of medical examinations and lab analysis and proof of measures taken on departure or in transit to eliminate infection or contamination. That sounds a lot like vaccine passports by another longer name. Under the amendments, anyone who refuses to be examined or vaccinated can be denied entry into a country. Another point of interest interpreted by some as a way to let private companies participate in both the war on misinformation and vaccine passport efforts is the provision that says non-state actors must comply with health measures taken under these IHR. This is probably granting powers of censorship to the type of groups that Moderna, Pfizer and government departments deploy to shut down online pundits who potentially speak out against some of their measures, allowing them to track, de-amplify, censor, shut down, demonize and even destroy significant voices in our community. Let me know in the chat if you think they would ever do anything like that. And the WHO can still declare an early action alert and a pandemic emergency, which sounds like they have the ability to bypass and overrule your national democracy if you're lucky enough to live in one, even though increasingly it seems like those words are redundant and irrelevant as words and language, ideas such as science and empiricism and morality and ethics and openness and transparency all fall away, as what becomes apparent is that during the pandemic period, an agenda was being enacted, and it seems less and less likely that that agenda was to help and protect people and ensure safe passage through a naturally occurring biochemical event. That seems almost like a ridiculous dream. Indeed, what is the conspiracy theory now? That a virus emerged from nature and the pharmaceutical industry helped to save us, or an event emerged from the pharmaceutical industry and the pharmaceutical industry benefited from it and various institutions used it as an opportunity to implement incredible measures that may yet not even have reached their peak. But that's just what I think. Why don't you let me know what you think in the comments and chat? Remember, support our movement for 1 month only. You can use the code ISurrender to get a month to view and enjoy our content. You can cancel at any time. That's how confident we are in our content. Join us, become a part of this movement. But more important than any of that, if you can, please stay free. Hey, thanks for watching. If you want to see more uncensored content where free speech can flourish, join our live stream. Click the link right here to watch the next video if you want to, or become a member of a growing movement. Download the Rumble app and you'll be informed every time we make a new piece of content. Stay free.